Dwayne Chase is a 32-year-old jackman for NASCAR who experienced a ripping sensation across the posterior superior aspect of his right shoulder when the hydraulic handle of the car jack malfunctioned. His arm hit the ground with a great amount of force, causing him severe pain and limited mobility. The majority of this phase will focus on pain control as well as introducing light and passive movement to the shoulder as it heals. Once adequate range of motion is acquired, the patient will move on to the next phase and begin strengthening exercises. Other areas of the arm, including the elbow, wrist, and hand, will be attended to as well to maintain range of motion and light strengthening exercises. Phase 1 short-term goals consist of having the patient educated on proper posture, protection of the shoulder, positioning of the shoulder and chest immobilizer, as well as proper hygiene. Influencing healing and decreasing pain by wearing the chest immobilizer with an abduction pillow for 2 to 6 weeks, only removing for showering and exercises regarding range of motion. Reducing pain and inflammation by applying ice every few hours every day for 6 weeks. Reducing pain by applying interferential electrical stimulation once a day with ice for 15 minutes. Preventing post-operative stiffness by performing controlled passive shoulder range of motion, and normalizing scapular position and mobility through therapeutic exercises during every visit. Long-term goals of Phase 1 consist of appropriately weaning off pain medication as instructed by the doctor, regaining full shoulder range of motion by 8 months post-operatively, regaining full shoulder strength by 9 months post-operatively, being able to functionally jump over the wall while carrying the jack by 9 months, and returning to full pain-free participation in 9 months. There should be acceptable shoulder flexion, scaption, abduction, and external rotation, and pain should be controlled and prescribed. Pain medication should not be necessary.
Alright, so to begin these exercises, you want to have your athlete in proper posture. So you want to have their back straight, shoulders back, and your chin slightly tucked. This creates a better anatomical position, and this is especially crucial for shoulder injuries because it keeps them at a better resting position. The first exercise we're going to do is scap retraction. So for this, I'm going to have Dwayne do elevation. So they're going to raise their shoulders up, depression, bring your shoulders all the way down, protraction, so I want you to puff your chest, and then retraction, puff your chest out. Good. For the next group of exercises, we're going to be doing cervical range of motion. For this, you're going to have your athlete do cervical flexion, so touch your chin to your chest. Then you're going to do extension, so look at the ceiling. Go back to neutral. Look left. Look right. That's for rotation. And then for lateral flexion, touch your ear to your shoulder on your right side. And now on your left. Good. The next range of motion that we're going to be doing is elbow range of motion. You can have your patient sitting down for this just because it won't restrict the elbow when it's doing extension. So you want to have the elbow bent to take the shoulder out of play and bring it out a little bit out of the immobilizer so it can get full range of motion. Now you're going to have your patient do flexion, which is a bicep curl, so do a bicep curl. And then extension, so you go all the way down as far as you can, and then come back up to neutral. And you're going to turn them in so they can do pronation and supination at the starting from neutral. So for supination, bring your have your forearm face the ceiling, and then go back to neutral, and then have your forearm face the ground. Good. Now we're going to be going over range of motion at the shoulder for passive range of motion. So for the first 2 weeks after surgery, they're not going to be doing any range of motion except for exercises at home that the hospital physical therapist gives them. For 2 to 6 weeks, they're going to be doing range of motion with me. So that's going to involve abduction, as far up as they can go, flexion, and external rotation. Now obviously with these, you're going to want to do it to where your patient is comfortable. And with a little bit extra. You don't want to increase their pain because they are out of surgery. So from 6 to 8 weeks, the patient is going to start doing passive range of motion by themselves, and they're going to be using a cane or a stick to facilitate this. So the patient's going to have a table and they're going to be lying down. They're going to have their elbows next to their side, and you're going to put the cane in their hands. And you're going to make sure the flat end is in their palm so they're not gripping it, so you take stress off of the shoulder. Now, for external rotation, you're just going to push them out and come back, and they can do this by themselves. Now, as the clinician, if you think that they are compensating by their elbow moving out or their shoulder, you can tuck their elbow into their side and then have them do the exercise. Good. Now, for the next part of the exercises, you're going to have your patient stand up. And they're going to be doing scaption and abduction with the stick. So, you're going to grip it. And for abduction, you're just going to have them slide right out as far as their limitations are with the range of motion, because they are post-surgical right now. So, by yourself. Good. And then for scaption, you're going to slightly angle the stick, and the patient's going to go more at a diagonal forwardly diagonal as well. Good. And you always want to make sure that your patient is keeping that good posture during these exercises. Good. The next exercise we're going to be doing is a therapeutic grip exercise. So for this, you're going to have the patient sitting, and you're going to have a towel to slide in between the arm and the shoulder. And this is going to keep the shoulder in a neutral position. So with the therapeutic, you're going to have that in their hand for them to grip, and then they're going to move it to a new spot, so then when they grip it again, it has equal resistance. For this exercise, you're going to be doing 2 sets for about 30 seconds each. The next exercise that we're going to be doing is going to be pendulums or pot stirrers. For this, you're going to have your patient in a larger than shoulder width stance. They're going to lean over, and their shoulder is just going to kind of like dangle, and they're just going to go side to side with their arm. Good. And then you're going to do front to back, so for this, you're going to need a different stance. So they're going to have their feet staggered with their left foot forward and the right foot back, and then go front to back with their arm as well, just with it dangling. Good. And then for the last part, for the pendulum exercises, you're going to go back to that original stance, and then you're just going to do circles. Good. And then you can reverse the circles as well. This exercise is mostly for pain control and joint relief because the shoulder is in a very relaxed state and it's just dangling. And you're going to be doing this for 15 reps each side, or if when you're going back and forth, you're going to do 15 each. So now that the exercises are done, we're going to be doing modalities, and for the first phase, we're going to be doing electrical stimulation. So you're going to have a pad connected to the front of the shoulder, and then one also connected to the back. And add ice as well, because this is going to be helping with pain control. If you have a wrap of some kind, that would work best to keep it tight on the shoulder. And then for this electrical stimulation, we're going to be doing 80 to 150 because we're trying to control the pain. So, Dwayne, I'm going to be turning up the E-stem, and you're going to let me know when it's strong but comfortable, or when you feel it and when it's strong but comfortable.
Okay.
It's going to feel like kind of like an internal massage.
Okay.
You ready? Let me know when you feel it.
I feel it.
And let me know when it's strong but comfortable.
A little bit more. Right there.
Good. You're gonna have them on this for 20 minutes, and then once they're done, you remove the ice and take the pads off.